Hello, everybody. My name is Leslie Gonzalez, and I'll be talking about tuberculosis today. Tuberculosis is caused by a bacteria called Mycobacterium tuberculosis. This bacteria usually attacks lungs, but can attack the brain, the spine, or the kidneys, other parts of the body. TB is transmitted through airborne particles, meaning that it can infect anybody. Not everyone who is infected by the bacteria becomes sick. Therefore, this results in two different conditions: latent TB infection and TB disease. TB infection, many people who have latent TB never develop TB disease, or the bacteria can remain inactive for a lifetime. People with latent TB have no symptoms, cannot spread TB to others. If they do get tested, it will come up positive, meaning they should be treated, because if they don't get treated, they can develop TB disease. TB disease is the active infection, meaning that they can spread this to others. And some people develop TB disease soon after becoming infected, within just weeks. Symptoms include a bad cough or persistent cough of 3 weeks or more, pain in the chest, coughing of blood or bloody sputum, weakness or fatigue, weight loss, no appetite, chills, fever, and night sweats. Recently infected are those who are high risk, so that includes close contacts. Close contacts can be people you live with, family members, coworkers, schoolmates, people you spend a lot of time with. People who immigrated from areas with high rates of TB. Groups with high rates already include the homeless population and people who use drugs. Housing situations, close corridors, this can be homeless shelters, correctional facilities, nursing homes. High-risk individuals are people who can develop the TB disease rapidly, which are people who are immunocompromised, HIV people, diabetes, certain cancers, and severe kidney disease are all high risk. Babies and young children, elderly, and IV drug users are also at high risk. TB test is one, there's multiple TB tests. One is the TB skin test. This is where you go into a provider's office at a clinic, hospital, any provider office, and they put a small amount of fluid on your lower arm, and it's called tuberculosis, for 1 day, and then within 48 to 72 hours, you return, and a healthcare provider or a trained professional will review the results, and depending on what they get, it will determine if it's positive or negative, and if more testing is needed to determine if it's latent or TB disease. Quantiferin is usually used for those who are probably not reliable for this TB skin test. The chest x-ray can be used to determine the TB disease and used to rule out pulmonary TB or any abnormalities in the lungs. The sputum smear is used to determine acid-fast bacilli, but it's not used to diagnose because there's multiple acid-fast bacilli bacteria. But the laboratory will do cultures, and depending on what the results are from that, we'll provide that to the provider, and will also, if it comes out positive, will inform the state and local health departments. The importance of TB: despite TB being very preventable or curable, 1.6 million people die from TB in 2021, and 187,000 people were people who had HIV. 10.6 million people contracted tuberculosis worldwide. This can include countries like the Philippines and South Africa and China. TB infection control in healthcare settings is really important. They provide many hierarchies. So one is the administrative controls. This includes this helps reduce the risk of exposure by conducting TB risk assessments, ensuring proper cleaning and sterilization. There's environmental controls, which prevent the spread of droplets in the air, which can be proper ventilation. And then the secondary for environmental controls is having the filtration, like the high efficiency particulate air filtration or ultraviolet germicide, and then providing and using respiratory protection and training healthcare personnel, and educating patients on respiratory hygiene and the importance of cough etiquette. And I want to thank you. And if you have any questions or comments, leave them down below. Thanks.